If you have a son who's around 6, 7 years old who can't sit still and has a hard time focusing and paying attention, and you have to repeat yourself over and over again for them to get to bed or brush their teeth or get ready for school, you might be tempted to think your son has ADHD. As a matter of fact, if your son is sitting in a classroom and has a hard time focusing and paying attention and is not necessarily completing their classwork, the temptation for teachers and schools to think your son has ADHD is going to be fairly large. And what I want to do is I want to caution all of us, prescribers, teachers, and parents, from rushing to judgment of labeling kids early elementary school age, boys specifically, is what this video is really about, for having ADHD. It's important to recognize the normal development of boys, that boys do tend to develop their brains later than girls, and that it's not uncommon for boys in a totally developmentally appropriate way to have a hard time sitting still and to not be able to attend to things that are not interesting to them. And it does not mean it's pathology. It does not mean they have a problem. The nature of our educational system is that we expect 6, 7-year-old boys to sit in desks and to be able to sit and to do tasks for certain periods of time that a lot of boys are not designed to do. And as a result, they come across that there's some sort of problem, and there really isn't a problem. This is just normal development of boys, and it does not mean they have ADHD. It does not mean they have a diagnosis, and it does not mean they need to be treated. I think it's important to be creative in recognizing that they just need breaks. They need to be able to move around. They need to be able to be physically active, and that we don't need to pathologize normal development of boys where we then start getting tempted to think there's something seriously wrong with them that requires a medication or some sort of intervention. And it does not mean there aren't boys who do have an issue with focusing and paying attention. That's different. That's not my point here. My point is that we need to understand development. We need to understand that there's things we should be doing to help these boys to be able to move around and to be able to listen better, like asking them to do one thing at a time and not to overwhelm them with 3 to 4 tasks to do where they're going to tune us out. It's not uncommon for boys, again, normal development, to not be interested in going to brush their teeth. Saying this both as a child psychiatrist and as a parent of 2 boys. And it's not because they have a problem or a pathology. It's because they're focused on other things that are more interesting and fun to them. And so please, let's not rush to judgment on labeling early elementary school age boys with ADHD when it's just normal development.